Please, sir, what is hemorrhoid?
Hemorrhoids, we also refer to them colloquially as piles. Okay, and medically we say they are actually abnormal swelling or enlargement of the anal cushion that develops inside the anus. When we say anal cushion, actually we are referring to a network of blood vessels within the lining of the anal canal, which sometimes become engorged with more blood than normal. Okay, so when these vessels engorge or enlarge, the overlying skin also enlarges with them, and together with the overlying skin, they form a kind of swelling that is referred to as piles or hemorrhoids. Hemorrhoids often don't cause any problem, but there are some that may cause problem. Along the line of discussion, we'll discuss some of the problems that are associated with hemorrhoids, because we advise that once you observe these swellings that we call hemorrhoids, you should see your surgeon for evaluation and proper treatment. Basically, there are 2 types of hemorrhoids. Some people will say 3 types, but with regard to the types of hemorrhoids, we will say there is what we call the internal hemorrhoid, external hemorrhoid, and this is with respect to their position in the anus. If we, for example, the anus is about 4 centimeters. If we divide the anus into 2 equal parts, 2 centimeters above and 2 centimeters below, then we can say that internal hemorrhoids are those ones that develop from the upper anus, while the external hemorrhoids are the ones that develop from the external anus. Usually the internal hemorrhoids, we don't really see them unless they prolapse through the anus. When I say prolapse, I mean they are when they protrude through the anus. But there are some persons that actually have both internal and external components of hemorrhoids. For those persons, we say they have internal external hemorrhoids. So basically, that is hemorrhoids. So I don't know if I can go ahead to classify hemorrhoids, or if you have anything.
Please go ahead, sir. Please go ahead, sir. Go ahead, sir.
All right. So hemorrhoids can be classified into 4. We have the 1st degree hemorrhoid, the 2nd degree hemorrhoid, 3rd degree hemorrhoid, and 4th degree hemorrhoid. Once we understand this classification of hemorrhoids, we will be able to know how hemorrhoids present, and as well know how we surgeons treat hemorrhoids. Now, the 1st degree hemorrhoid, in 1st degree hemorrhoid, the patient bleeds when he or she goes to the toilet to use the toilet. Okay? And usually the bleeding is characteristic. The blood is bright red, and it's often observed when the patient wipes his or her anus. Just see the blood on the toilet paper. Okay, there are other situations where the blood just splashes on the pan of the toilet. After purification, they just see some streak of blood on the surface of the stool. This is basically how these patients present. These patients with hemorrhoid present. That is 1st degree hemorrhoid. But apart from this blood that they see, there's usually no protrusion from the anus. That is 1st degree. Now, for 2nd degree, they see protrusion from the anus, from the anal canal after defecation. But usually, this protrusion returns back to the anal canal after the defecation. For the 3rd degree, there is a protrusion from the anus, which does not return after defecation. The person needs to use his or her finger to push the protrusion back to the anal canal. While for 4th degree hemorrhoid, there's a protrusion from the anal canal that the person cannot even use his or her finger to push back. That is, the hemorrhoid is persistently prolapsed. These are the different classifications of hemorrhoids. So whatever the degree the patient is presenting with, that is how we also manage hemorrhoids. If I may continue, I would like to talk about the causes of hemorrhoids. I don't know if I can go ahead to talk about the causes of hemorrhoids.
Sir. Now, people will want to ask, as we talk about the causes, what are those things that can make an individual have hemorrhoids?
Okay, so the causes of hemorrhoids. Basically, I want to say that we don't know the exact causes of hemorrhoids. We don't know the exact causes of hemorrhoids. Some hemorrhoids seem to develop for no apparent reason. So you'll be able to say, because of this hemorrhoid developed. Okay? But in general terms, we believe that hemorrhoids develop because of two reasons. One of them is when there is increased pressure in the anus. While secondly, when there is weakness in the wall of the anal canal. Anything that can lead to these two things will cause the development of hemorrhoids. And these include one, constipation. When I say constipation, I mean passage of hard feces. Okay? So what leads to constipation most of the time is the fact that some persons don't go to toilet when they are supposed to go to toilet. They feel pressed, but they want to delay defecation. Once you delay defecation, the large intestine will have time to absorb all the water from the feces. And once that is done, what you are going to pass is hard feces. And you need extra pressure to push out these hard feces. And in the process of pushing out these hard feces, these hemorrhoids become enlarged. This is one reason why people develop hemorrhoids, because of constipation and the pressure that is associated with straining to push out the feces. There are other group of persons too that we have mentioned some time ago that spend a lot of time in the toilet facility. When they go to the toilet, they stay there for a long period of time. What do they do there? Some of them will be reading novels, some will be pressing their phones. In fact, some review their WhatsApp chat while in the toilet in the morning. And by the time they spend prolonged period of time in the toilet, they end up pushing out their hemorrhoids. This is one of the reasons why hemorrhoids develop. Then another reason is hereditary factors. Okay, so we've observed that some people may inherit the weakness of this wall in the rectum. Once there is inheritance of this weakness, members of that family tend to develop hemorrhoids. In this group of persons, we see that different members of their family come down with hemorrhoids. So for those ones, we say those are, hereditary hemorrhoids. The hemorrhoid also develop with aging. The tissue in the lining of the anus may become weak and less supportive as one becomes older. So in this, we see that hemorrhoids may be commoner among the elderly patients because the wall of their anal canal is already weak, and those engorged vessels, the tendency for them to prolapse now becomes very high. Hemorrhoids is also common among pregnant women. How does this one occur? Due to two mechanisms. One is the pressure effect of the baby lying above the rectum and the anus. Because of the pressure that is resulting from that baby above the anus, the hemorrhoids tend to enlarge and prolapse. Okay. The other mechanism that leads to hemorrhoids in pregnant women is because of the hormones that are produced in pregnancy. These hormones can lead to weakness of the wall of the anus. And you can see that in pregnancy, the two mechanisms actually combine. The increased pressure within the anus and the weakness of the wall and the supporting tissue around the anus. So with these two mechanisms occurring, the rate of hemorrhoids is very high among pregnant women. But the good thing about hemorrhoids developing in pregnancy is that most of them go away after childbirth. But there are still some percentage of patients that may still put to bed and their hemorrhoids will persist. Another factor that may lead to development of hemorrhoids is being overweight. Patients with obesity, excessive weight may come down with hemorrhoids. It's improving over time. Then with all these patients that have predisposition to developing hemorrhoids, if there are other factors at all that will make them to strain, or any factor that will increase the pressure within their rectum, for example, when they carry heavy loads or they have chronic cough, the rate at which you develop hemorrhoids become higher. All these causes of hemorrhoids, I've been saying, they are the straightforward hemorrhoids. You know, there's a particular group of persons that we need to understand, because this group of persons may have something more sinister without knowing. They will just think that they have hemorrhoids. Call this one secondary causes of hemorrhoids. For example, some patients with cancer of the rectum, they actually present with hemorrhoids. This group of persons, we think that they have hemorrhoids. They may even see some of us that are health practitioners, we'll see them and think that they have hemorrhoids, not knowing that there is cancer within the rectum that is actually causing the engorgement of this anal cushion, thereby pushing out the hemorrhoid. So when we see patients come down with hemorrhoid, we should be very careful to examine them properly and make sure the hemorrhoid is straightforward hemorrhoid or the hemorrhoid is secondary to another problem like cancer of the rectum. This is particular with patients that are above 50 years of age. So when we see any patient that is above 50 years of age, or we see any patient that has symptoms that may suggest cancer of the rectum or cancer of the colon, we try as much as possible to examine this patient further to make sure there is no cancer there that is causing the hemorrhoid. In other words, we will say that hemorrhoids may just be straightforward hemorrhoid, and in other situations, hemorrhoids may just be an underlying cancer that is pushing out the hemorrhoid, thereby an underlying cancer disguising as hemorrhoid. So we should be careful about hemorrhoid. So it is not every hemorrhoid that we should see as hemorrhoid. So we advise that once our patients have hemorrhoids, they should see their healthcare practitioners, who will decide whether it's a straightforward hemorrhoid or not, and whether if it's a straightforward hemorrhoid, they will be the one to treat. Okay? Basically, if I can still continue, I will quickly talk about the clinical features of hemorrhoid.
Okay, Chief, I want to ask, you just mentioned, you just related hemorrhoid, well, not related per se, but you just talked about hemorrhoid as presenting almost like cancer. So I would want you to please tell us the clinical features or the symptoms of hemorrhoids and how can we differentiate it from cancer. That means the symptoms of hemorrhoids and then symptoms of cancer, and the ones that are peculiar to, the symptoms that a patient will present and would now that are suggestive of cancer instead of hemorrhoid.
All right. Okay. So now the symptoms of hemorrhoid, basically, I'll start by saying that some hemorrhoids are asymptomatic. That is, they don't present with any symptoms. They will just develop there, but won't present with symptoms. But for those patients that present with symptoms, the commonest symptom is actually constipation. That is, when you go to toilet to pass through the bleed, and like I said earlier on, that the blood is usually bright red blood. So like I was saying, I said the commonest symptom of hemorrhoid is actually bleeding on defecation. And these patients, when they stool and wipe their anus, they see some blood on the toilet paper. While some, they just see some splash of blood on the pan of the toilet, while the other one, they will just see some streak of blood on the surface of the stool. These are ways that hemorrhoids present. While in some other patients, there's actually something hanging out through the anus. That is, there is a protrusion through the anus. Called one prolapse. That is, those hemorrhoids, they've been so engorged that they now prolapse through the anus. Okay? So for those ones with hemorrhoids that are prolapsing through the anus, they will tell you that their time after passing through, the hemorrhoids return. Okay? While for some, after passing through, they will use their finger to push back the hemorrhoid, like I mentioned previously. Then in other categories, the hemorrhoid will just be out and they will be able to push them in. These are different presentations of hemorrhoid. Then for some patients, the hemorrhoid may grow so large that it will now be causing some irritation around the anus. And for some patients, there's actually discharge of mucus. The mucus irritates the anus, and they will present with itching around the anus. But basically, hemorrhoids don't present with pain, except when it's complicated. These are, symptoms of straightforward hemorrhoid. Like I said previously, there may be some patients with cancer in the rectum, in the intestine, that may make hemorrhoids, because this cancer, in a way, may cause enlargement of this anal cushion, and the patient will actually present with hemorrhoids. With those features of hemorrhoids, bleeding, anal protrusion, then you see the anal protrusion and you just think it's hemorrhoids, not knowing that there is something more sinister there that is causing the patient to present with symptoms of hemorrhoids. How do we recognize these persons that have cancer? One, these persons are presenting with hemorrhoids for the first time after the age of 50 years. So that is to say, once we see our patients that have symptoms of hemorrhoids occurring for the first time after the age of 50 years, we must make sure we rule out the possibility of cancer causing hemorrhoids. Then, if also we have a patient presenting with hemorrhoids, and the patient also has constipation that is alternating with diarrhea, that means there is change in the bowel habit. When I say change in the bowel habit, I'm referring to a situation whereby somebody, for example, that was going to toilet once in every day, now goes to toilet once in 2-3 days. It means there is already a change in the person's bowel habit. And if this is occurring with hemorrhoids, then we will also make sure we rule out the presence of a cancer causing the hemorrhoids. So basically, a patient presenting with hemorrhoids above the age of 50 years, or a patient with hemorrhoids presenting with change in his or her bowel habit, will make us to suspect cancer of the rectum as a precipitating factor for the hemorrhoids. With that said, I also want to state that some hemorrhoids may present with complications, and there are two major complications of hemorrhoids that we see. These are one, strangulation. When we say strangulation, it means there is a block of life of the hemorrhoid cut off. And when this happens, there is thrombosis of the hemorrhoid, wherein there will be accumulation of clots within the hemorrhoid. This is a bad surgical emergency that needs to be treated as an emergency. That is one of the complications of hemorrhoid, which is left untreated. The other complication is actually excessive bleeding. Some is present with major bleeding that will even warrant them being admitted for blood transfusion and stabilization. These are the clinical features of hemorrhoids.
The patient is a man, a middle-aged man. He presented with symptoms of pulsation, as if he described it as something passing through, as if constantly passing through somewhere around his anus. Yeah. Pulsation.
Pulsation. Hemorrhoids don't present like that. Okay, hemorrhoids don't present like that. That's why we always advise that when a patient has any funny presentation, especially those ones that are involving the anus, they will need to see their physician for a thorough evaluation. Hemorrhoids do not present with any pulsation. All hemorrhoids is alike, and the presentation is either bleeding, bright red blood, or a protrusion, an outside protrusion from the anal canal. Like I also said, they may also have some irritation around the anus and may cause itching. These are the ways hemorrhoids present. But if somebody has another symptom around the anus, there are other things that can cause such symptoms apart from hemorrhoids. So those are candidates that benefit from the proper review in the hospital setting. Let me just quickly add, because once that is the case, those patients they benefit from further investigation when they come to the hospital. Okay, so that is what we always tell patients, because some patients tend to treat themselves at home. They think when they think that they have hemorrhoids. So we always ask ourselves, do you need any test for hemorrhoids? Do you need any test for hemorrhoids? That's the question we ask patients. Do you think you need any test for hemorrhoids? And the answer is yes. Because by the time you come to the hospital to first of all take the history, and with the history, they will decide whether this is hemorrhoid or not. But they will still move ahead after the history to examine you properly. And some of the examination will involve examining the anus and the rectum. Okay? So once that is done, if there are hemorrhoids, your doctor may see the hemorrhoids or may feel the hemorrhoid. Okay? But even if it's difficult to see or feel the hemorrhoid, they may go ahead to do further examination for you, like the use of proctoscope. The proctoscope is just an instrument that may be put into the anus and the rectum to visualize the wall of the anus and the rectum, and if there are hemorrhoids, the bronchoscope will see them clearly. Now, for those other patients that were discussing earlier that may have cancer presenting or mimicking hemorrhoids, for those patients, if you see something that is suspicious, you may now recommend a more specialized investigation for that patient. And one of those investigations is what we call colonoscopy. They will have to take another instrument called colonoscope to look at the entire large intestine to see if there is actually something there that is suspicious. Okay? And once that is done, if there is actually something, a part of that thing can be collected and sent for test. So if there is actually cancer that is causing that hemorrhoid, we will not find it when we do some tests for the specimen that is collected on colonoscopy. Okay, so that is why we advise that once you observe something, whether you think it's a straightforward hemorrhoid or not, please allow your physician to be the judge rather than self-medication at home. Because when you come to the hospital, they will evaluate you and tell you whether it's a straightforward hemorrhoid or not. And whether it's a straightforward hemorrhoid, they will have to classify it whether it's first degree, second degree, third degree, or fourth degree, because each of the degrees has its own treatment modality.
Can we prevent hemorrhoids? Can hemorrhoids be prevented?
Okay, so well, I want to say that we can treat hemorrhoids, but hemorrhoids may be difficult to prevent. Now, remember at the beginning I said there are some persons with hemorrhoids that we may not be able to attribute the cause of the hemorrhoid to anything. Okay, so for those patients that we may not be able to tell the cause of the hemorrhoid, it will be difficult to prevent the hemorrhoid. But basically what can be done is, even as we are, there are certain persons now that are online with us that may have hemorrhoid, even without knowing that they have hemorrhoid, some that they have hemorrhoid. But basically what can be done is, we can avoid all those things that we mentioned before. Are you getting me? Those things that we mentioned that are risk factors for hemorrhoids, you can actually avoid them. So that is to say, one, avoid constipation and straining when we go to the toilet. Avoid constipation and avoid straining when we go to the toilet. That is to say, everybody should try as much as possible to take food that will prevent them from having constipation. Food rich in high fiber, for example, like fruits, vegetables, cereals. These are high fiber diets. This will prevent constipation. And once it's prevented, hemorrhoids to some extent can be prevented. We also advise that patients should take plenty of food, or people should take plenty of food, take plenty of water, because this will make the stool to be soft, thereby preventing hemorrhoid. And even when you have hemorrhoid, when you have first degree hemorrhoid, and you abide by these rules, it will also prevent the hemorrhoid from not progressing from first degree to second degree, for example, because the higher the degree of hemorrhoid, the worse symptoms that you will have. And those patients with first degree hemorrhoid, once you can prevent them from progressing to second or third degree hemorrhoid, they won't even require operation. Just this lifestyle modification is enough for them. So another thing we also advise is to avoid drugs that contain codeine. There are some painkillers that we take that contain codeine. Codeine is an agent that constipates. So drugs like there's a form of paracetamol that contains codeine. We call it coconut, for example, contains codeine. Okay, and other opioid containing drugs like tramadol and the rest. These drugs cause constipation, and once you take them and you are constipated, you will strain to pass this. And when you are straining, you develop hemorrhoids. A particular example are people that like postponing their food gratification. No, this is a very bad practice. I can give an example with some ladies that attend the secondary school that in hostel. Some of them want to stay in school for a week without going to toilet because of the poor state of their toilet facility, and they want to go home by weekend to not pass. By the time they get to a weekend, their school will be so hard that they will strain and strain to pass the school. And this training will cause an increase in the pressure within the inner canal, and while they are pushing the stool out, they are also pushing out the hemorrhoid. This is one of the risk factors of hemorrhoid. And if you can abstain from this, you will be preventing hemorrhoid. That is to say, whenever you feel like